torn tissues, exploding what now, and days-long cramps that'll make you rethink your existence. Today, we're talking about 5 of the most painful medical experiences women face. Some are common, some are nightmare fuel, and all of them worth knowing about. All right, let's dive right in. Number 5, Bartholin cyst. This one might sound small from its name, but don't let the size fool you, because when a Bartholin gland goes rogue, the pain is very, very big. And for some women, it becomes an all too familiar horror story. Put simply, there are 2 tiny pea-sized structures located just inside the vaginal opening, one on either side. Their job, to secrete a small amount of fluid to keep things, let's say, well lubricated during intimate moments. But here's where things go sideways. If the tiny duct leading out of the gland gets blocked due to anything from minor trauma, irritation, or even an infection of some sort, the fluid backs up, pressure builds, and boom, you've got yourself a full-blown Bartholin cyst. And yes, sometimes the cyst is small and painless, you might not even know it's there. But other times, it becomes inflamed, infected, and evolves into a full-blown abscess. Think red hot, swollen, and painful. Sometimes patients describe it to me as a hot poker between their legs, or like passing a kidney stone from the vaginal opening. We're talking about that level of pain in severe cases. And what's also not pleasant, in the ER, us docs usually have to lance it open and drain it. Not fun for anyone involved. It's crazy that this tiny gland can cause so much agony for a patient, but it does. So what causes these excruciating cysts? Lots of different things could be the culprit. For starters, infections, especially from bacteria like E. coli, or in some cases, STIs like gonorrhea or chlamydia. Minor trauma to the area like shaving, waxing, or vigorous activity could also do it. Number 4, most painful thing, ruptured ovarian cyst. Ever felt a stabbing pain in your lower abdomen and thought, this is it? Because the pain is just that bad, only to then just be told, surprise, ovarian cyst that popped. One minute you're fine, living your life, the next it feels like a tiny grenade went off inside your lower abdomen. So what are these cysts exactly? Ovarian cysts are fluid-filled sacs that develop on the ovaries. Super common, most women will have at least one in their lifetime, and many don't even know it. They're usually part of your normal cycle. Most cysts are harmless, but if they rupture, that fluid spills into your pelvic cavity, irritating the surrounding tissue and nerves, and the pain, instant, sharp, deep, and typically on one side, depending on which ovary said, I'm out. You'll know it when it happens because symptoms can include sudden stabbing pelvic pain, abdominal bloating, nausea or vomiting, or fainting episodes. So what exactly causes them to rupture, you might be wondering. Sometimes trauma, like during a workout or sex, sometimes it's hormonal, and sometimes it's just Tuesday. For mild ruptures, we'll suggest pain management, rest, and fluids. For some serious cases, especially if there's blood loss or signs of infection, we're talking IV fluids, imaging, and possibly surgery to stop the bleeding or remove the cyst entirely. And if you're someone who gets them often, doctors might prescribe hormonal birth control to regulate your cycle and prevent new cysts from forming. Number 3, female-oriented pain, vulvodynia. Sorry to report, this next one is the ultimate gaslight special, because for years, women with it were told it's just in your head. But trust me, it's very real, very painful, and very misunderstood. Chronic, unexplained pain in the vulva. That's the outer part of the female genitals, including the skin, the lips, and the entrance. And it can feel like you sat on a hornet's nest for hours, or like a sharp, stinging pain that just won't quit. Sounds pretty horrific, right? But the kicker is that's just from doing normal things like sitting, walking, or trying to wear something as lightweight as leggings. What causes this painful medical problem? That's the frustrating part. Vulvodynia is what we call a diagnosis of exclusion, meaning we don't always know the cause and there's no visible wound or infection. It's often linked to nerve dysfunction, basically pain signals going haywire, or hormonal shifts sometimes, like post-birth control or menopause. How common is it? Well, it's not uncommon. Studies suggest up to 16% of women will experience vulvodynia at some point in their lives, but it often goes undiagnosed because people either don't talk about it or doctors dismiss it as just stress or some other unrelated issue. Now, let's talk treatment. And no, you're not doomed to a lifetime of sitting on donut pillows. There are options: pelvic floor physical therapy, topical creams like lidocaine gels that numb the nerve endings, neuropathic pain meds, or even one that may surprise you, Botox injections. It can help relax hyperactive pelvic muscles and reduce pain. Number 2, endometriosis. For the ladies watching this who deal with it, you already knew this one was making the list, probably near the top. But if you've never experienced it, let me paint the agonizing picture for you. Imagine your uterus isn't content with just ruining 1 week a month in terms of cramping, pain, fatigue, etc. Instead, it decides, you know what? No. Let's send tissue scouts on a mission, planting bits of itself on your ovaries, fallopian tubes, bladder, intestines, and anywhere else it can reach. This is endometriosis, when tissue similar to the uterine lining grows outside of the uterus and still tries to act like it's on a normal period cycle. It builds up, bleeds, gets trapped, and causes pain, swelling, and sometimes organ fusion. It's not just during that time of the month either. Some people feel stabbing pain during ovulation, others during sex, some just always, and still have to live their life like they aren't always in pain. To make matters worse, it can take up to 7 to 10 years on average to even get diagnosed, because too often women are told it's just part of being a woman, which is pretty messed up. Treatment isn't a one-size-fits-all either. Hormonal birth control can suppress symptoms, excision surgery can remove endometrial tissue. There's also physical therapy, pain medications, lifestyle management, and in some severe cases, hysterectomy, as in surgical removal of the uterus, which can mean the end of periods, but also the end of fertility. Number 1 painful thing a female can experience: childbirth, unmedicated. And finally, we've arrived at the pain scale's final boss: childbirth. Quick anatomy lesson first. One's uterus, a muscle roughly the size of a pear, starts contracting with a force of about 400 newtons of pressure. That's the kind of force you'd normally associate with a sports injury, blunt trauma, or heavy machinery injuries. And I know that sounds bad, but keep in mind that pain is coming in waves of every few minutes for hours. Adding to that chaotic picture, your cervix, an opening typically the width of a fingertip, is dilating to 10 centimeters. Pelvic bones are shifting, your abdominal muscles are contracting like they're in a heavyweight boxing match, and all your organs are politely getting shoved out of the way. The pain, it's different for everyone, of course, but most describe it as a deep, bone-rattling ache that builds, peaks, and crashes in waves. Think menstrual cramps times 100, plus back labor, pressure in places you didn't know you had nerve endings, and sometimes tearing. Now, modern medicine has blessed us with epidurals, nerve blocks, and various medications to help ease the pain during childbirth, and many people choose them, but those who go without, they're either incredibly brave, deeply committed to a birth plan, or stuck in traffic and didn't make it in time. Believe me, I see it all the time. Women come into the ER with very advanced labor, and unfortunately, there's just no time for an epidural, and it is full-blown birth mode initiated. So there you have it, 5 of the most painful, terrifying, and unforgettable things that can happen to a female body. If you winced even once, go ahead and hit that like button and binge watch this entire playlist right here with more painful things a human can experience. And of course, make sure you subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.